Well, good day, everybody, and welcome to the Psychological Disorders edition of 5-Minute Psych. In this 5-minute segment, we'll look at personality disorders, beginning with how we define personality disorders before elaborating on each of the three clusters of disorders. Then we'll focus on antisocial personality disorder and borderline personality disorder and discuss potential causes for each. Someone can be said to have a personality disorder when they consistently and naturally think, feel, and behave in a way that is inflexible and maladaptive. And they can't help it. It's just how they see things and react to them. Overall, researchers have identified 10 different personality disorders, but they cluster together in one of three different types: dramatic impulsive behaviors, anxious fearful behaviors, and odd and eccentric behaviors. Now we'll look at the different personality disorders that belong with each cluster. In the anxious and fearful cluster, we have avoidant personality disorder, when the person feels extreme social discomfort, as if they're being negatively judged by everyone constantly. Also included in this cluster is dependent personality disorder, when the person shows extreme dependence and submission, and also gets very distressed when separated from the person upon whom they're dependent. Finally, obsessive-compulsive personality disorder, which is different from the anxiety disorder, when the person is plagued by anxiety-provoking thoughts that go away when they perform some behavior. Here, the person shows extreme perfectionism and inflexibility and is preoccupied with having control over everything. Included in the odd and eccentric cluster is paranoid personality disorder, when the person consistently interprets the behavior of others as threats. We also have schizoid personality disorder here, which is when the person is indifferent to social relationships and is emotionally blank. Finally, there's schizotypal personality disorder, when the person comes across as very odd in terms of their appearance, behavior, and thoughts, and they're also very uncomfortable in social situations. In the dramatic and impulsive cluster, we have histrionic personality disorder, when the person has overly dramatic emotional reactions and is constantly seeking attention, while at the same time, they're very impressionable. Also included in this cluster is narcissistic personality disorder, when the person thinks that they're the center of the universe and they constantly need to be admired by others. They also show lack of empathy, unable to consider what anyone else might be thinking or feeling. Now we'll focus on the last two disorders that belong to this cluster, antisocial and borderline personality disorders, as these are the two that we know the most about. Antisocial personality disorder is when the person is impulsive, feels little empathy to another's suffering, lacks a conscience, and doesn't get deterred by punishment at all. And don't think that because they're antisocial that they're socially inept. Quite the contrary. These people can be charming and manipulative. Also, don't assume that they're all criminals, but the fact that they lack emotional attachments can certainly make them a danger to society. Although we don't know exactly what causes antisocial personality disorder, there are some physiological factors that have been identified. For instance, we know from family studies that it's partly genetic, and this could manifest in chemical differences, such as lower levels of stress hormones and lower serotonin, or structural differences in the brain, such as impaired functioning of the amygdala and frontal lobes, the areas linked with emotion as well as judgment and impulse control. But there are also psychological factors involved. For example, children who have parents who model this kind of behavior are more likely to develop antisocial personality disorder. Borderline personality disorder is when the person experiences intense extremes between positive and negative emotions. Emotionally, they swing far and often in both directions. They have very intense and unstable personal relationships, falling in love quickly but also fearful of abandonment, so they become very clingy and manipulative. They're also very impulsive and engage in a lot of self-destructive behavior. And because of their symptoms, they're some of the most difficult cases to treat. The causes of borderline personality disorder are not known, but many of the people suffering have had extremely traumatic early experiences. So that seems to be a factor. But we also know that it's partly inherited because we're more likely to be diagnosed if a close relative has it too. Well, we just discussed personality disorders by starting with the definition of personality disorders before examining the three clusters of disorders. Then we focused on antisocial and borderline personality disorders, including potential causes for each. Now, aren't you glad you had 5 minutes?